Question 1. A 72-year-old client with a history of chronic heart failure presents with sudden weight gain of 2.5 kilograms in 3 days, mild dyspnea on exertion, and bilateral ankle edema. The nurse reviews the prescribed medications and dietary plan. Which action should the nurse take first? A. Administer the prescribed loop diuretic immediately. B. Educate the client on fluid restriction compliance. C. Assess lung sounds and oxygen saturation. D. Notify the healthcare provider of rapid weight gain. Answer: C. Assess lung sounds and oxygen saturation. Rationale: airway and breathing take priority, assess severity before intervention. Question 2. A postoperative client reports pain rated 8 out of 10 but appears calm, scrolling on their phone, and conversing normally. What is the most appropriate nursing action? A. Withhold pain medication due to inconsistency. B. Reassess pain in 30 minutes. C. Administer prescribed analgesic. D. Document suspected drug-seeking behavior. Answer: C. Administer prescribed analgesic. Rationale: pain is subjective, treat based on patient report. Question 3. A client receiving 4 potassium chloride reports burning at the infusion site. The 4 site appears slightly reddened but patent. What should the nurse do first? A. Slow the infusion rate. B. Discontinue the 4 line. C. Assess for infiltration or phlebitis. D. Apply a warm compress. Answer: C. Assess for infiltration or phlebitis. Rationale: always assess before intervening. Question 4. A diabetic client becomes diaphoretic, shaky, and confused. The blood glucose is 58 mg per deciliter. The client is conscious and able to swallow. What is the priority action? A. Administer 4 dextrose. B. Give 15 g of oral glucose. C. Call the provider. D. Prepare glucagon injection. Answer: B. Give 15 g of oral glucose. Rationale: conscious patient equals oral glucose first. Question 5. A nurse enters a client's room and finds the client unresponsive with no visible chest movement. What is the first action? A. Call for help. B. Begin chest compressions. C. Check pulse and breathing. D. Activate code blue. Answer: C. Check pulse and breathing. Rationale: confirm arrest before initiating CPR. Question 6. A client with COPD is receiving oxygen at 6 liters per minute via nasal cannula and becomes increasingly drowsy. What is the nurse's priority action? A. Increase oxygen flow. B. Lower oxygen flow. C. Obtain arterial blood gases. D. Encourage deep breathing. Answer: B. Lower oxygen flow. Rationale: high oxygen can suppress respiratory drive in COPD. Question 7. A client scheduled for surgery states, I signed the consent, but I don't understand the procedure. What should the nurse do? A. Explain the procedure in detail. B. Notify the surgeon. C. Witness the signature. D. Cancel the surgery. Answer: B. Notify the surgeon. Rationale: only the provider explains procedure risks/benefits. Question 8. A client with a new tracheostomy suddenly develops respiratory distress. What is the nurse's first action? A. Suction the airway. B. Call the rapid response team. C. Assess for tube obstruction. D. Administer oxygen. Answer: C. Assess for tube obstruction. Rationale: always assess cause before intervention. Question 9. A nurse notes that a client's 4 pump is alarming occlusion, and the client reports pain at the site. What is the priority action? A. Silence the alarm. B. Flush the 4 line. C. Stop the infusion. D. Reposition the arm. Answer, C. Stop the infusion. Rationale, prevent further harm before troubleshooting. Question 10. A client with sepsis has a blood pressure of 86/50 mmHg, heart rate 122 bpm, and urine output of 15 milliliters per hour. What is the priority intervention? A. Administer 4 fluids. B. Start antibiotics. C. Insert Foley catheter. D. Provide oxygen. Answer, A. Administer 4 fluids. Rationale. Circulation support is priority in shock. Question 11. A 64-year-old client with a history of hypertension suddenly develops slurred speech and right-sided weakness. The nurse notes the symptoms began 20 minutes ago. What is the priority nursing action? A. Administer aspirin. B. Obtain blood glucose level. C. Activate stroke protocol. D. Elevate the head of bed. Answer, C. Activate stroke protocol. Rationale, time-sensitive emergency, rapid intervention is critical. Question 12. A client receiving a blood transfusion develops fever, chills, and back pain 10 minutes after initiation. What is the first action? A. Notify the provider. B. Stop the transfusion. C. Administer antipyretics. D. Increase 4 fluids. Answer, B. Stop the transfusion. Rationale, prevent further reaction immediately. Question 13. A nurse is caring for a client with a chest tube connected to suction. The nurse notices continuous bubbling in the water seal chamber. What should the nurse do first? A. Increase suction pressure. B. Clamp the chest tube. C. Assess for air leak. D. Notify the provider. Answer, C. Assess for air leak. Rationale, continuous bubbling suggests leak, assess before acting. Question 14. A postoperative client becomes restless, tachycardic, and has a decreasing oxygen saturation. What is the nurse's priority action? A. Administer pain medication. B. Increase 4 fluids. C. Apply oxygen. D. Notify the provider. Answer, C. Apply oxygen. Rationale, hypoxia signs. Address airway first. Question 15. A client with hyperkalemia, K equals 6.5 milliequivalent/L, is on cardiac monitoring. The nurse observes peaked T waves. What is the priority action? A. Administer potassium supplements. B. Prepare for dialysis. C. Administer calcium gluconate. D. Restrict fluids. Answer, C. Administer calcium gluconate. Rationale, stabilizes cardiac membrane immediately. Question 16. A client is found on the floor after attempting to ambulate without assistance. The client states, I'm fine. What is the nurse's first action? A. Assist the client back to bed. B. Document the fall. C. Assess for injuries. D. Notify the provider. Answer, C. Assess for injuries. Rationale, always assess before moving. Question 17. A nurse is preparing to administer insulin but notices the client's meal tray has not arrived. What is the best action? A. Administer insulin as scheduled. B. Hold insulin until meal arrives. C. Give half the dose. D. Notify the provider. Answer, B. Hold insulin until meal arrives. Rationale, prevent hypoglycemia. Question 18. A client with asthma is using accessory muscles and has difficulty speaking in full sentences. What is the priority action? A. Administer bronchodilator. B. Provide oxygen. C. Place in supine position. D. Encourage fluids. Answer, A. Administer bronchodilator. Rationale. Reverse bronchospasm immediately. Question 19. A nurse notices a colleague administering medication without checking the patient's ID band. What is the best action? A. Ignore the behavior. B. Report immediately to supervisor. C. Confront the colleague and stop the process. D. Document the incident. Answer: C. Confront the colleague and stop the process. Rationale: immediate patient safety comes first. Question 20. A client with suspected meningitis is admitted. Which action should the nurse implement first? A. Start 4 antibiotics. B. Place the client in droplet precautions. C. Obtain blood cultures. D. Assess neurological status. Answer: B. Place the client in droplet precautions. Rationale: prevent transmission immediately. Question 21. A 58-year-old client with type 2 diabetes mellitus is scheduled for a CT scan with 4 contrast. The nurse reviews the medication list and notes the client takes metformin daily. What is the priority nursing action? A. Administer metformin as scheduled. B. Hold metformin before the procedure. C. Encourage increased oral fluids. D. Monitor blood glucose after the procedure. Answer: B. Hold metformin before the procedure. Rationale: prevent lactic acidosis risk with contrast. Question 22. A client with a nasogastric (NG) tube suddenly begins coughing and shows decreased oxygen saturation during feeding. What is the nurse's first action? A. Stop the feeding. B. Check tube placement. C. Suction the airway. D. Elevate the head of bed. Answer: stop the feeding. Rationale: prevent aspiration immediately. Question 23. A client with a history of deep vein thrombosis reports sudden chest pain and shortness of breath. What is the priority action? A. Administer anticoagulants. B. Elevate the legs. C. Apply oxygen. D. Notify the provider. Answer: C. Apply oxygen. Rationale: suspected pulmonary embolism, support oxygenation first. Question 24. A client receiving morphine becomes difficult to arouse with a respiratory rate of 8 per minute. What is the nurse's priority action? A. Stimulate the client. B. Administer naloxone. C. Call the provider. D. Apply oxygen. Answer: B. Administer naloxone. Rationale: reverse opioid-induced respiratory depression. Question 25. A nurse is caring for 4 clients. Which client should be assessed first? A. Client with fever of 38.3 degrees Celsius requesting acetaminophen. B. Client with new onset confusion. C. Client with chronic back pain requesting medication. D. Client scheduled for discharge. Answer: B. Client with new onset confusion. Rationale: acute mental status change equals priority. Question 26. A postoperative client has a saturated abdominal dressing. What is the nurse's first action? A. Reinforce the dressing. B. Remove the dressing. C. Notify the provider. D. Assess vital signs. Answer: D. Assess vital signs. Rationale: determine hemodynamic stability first. Question 27. A client with a Foley catheter has no urine output for 2 hours. What should the nurse do first? A. Notify the provider. B. Irrigate the catheter. C. Check for kinks in tubing. D. Increase fluid intake. Answer: C. Check for kinks in tubing. Rationale: start with simple assessment. Question 28. A client is receiving heparin infusion and develops bleeding gums. What is the priority action? A. Stop the infusion. B. Check APTT level. C. Administer protamine sulfate. D. Notify the provider. Answer: stop the infusion. Rationale: prevent further bleeding immediately. Question 29. A nurse is about to administer a medication but notices the dosage seems unusually high. What is the best action? A. Administer as prescribed. B. Clarify the order with the provider. C. Ask another nurse for opinion. D. Hold the medication. Answer: B. Clarify the order with the provider. Rationale: always verify questionable orders. Question 30. A client with increased intracranial pressure suddenly vomits and becomes less responsive. What is the nurse's priority action? A. Turn the client to the side. B. Administer antiemetics. C. Notify the provider. D. Raise the head of bed. Answer: A. Turn the client to the side. Rationale: prevent aspiration immediately. Question 31. A client with a history of myocardial infarction reports sudden chest pain unrelieved by nitroglycerin. The client appears pale and diaphoretic. What is the nurse's first action? A. Administer morphine. B. Apply oxygen. C. Obtain a 12-lead ECG. D. Notify the provider. Answer: C. Obtain a 12-lead ECG. Rationale: in suspected MI, ECG within 10 minutes is priority for diagnosis and treatment pathway. Question 32. A nurse is caring for a client with a potassium level of 2.9 milliequivalent/L. The client reports muscle weakness and fatigue. What is the priority action? A. Administer potassium replacement. B. Monitor cardiac rhythm. C. Encourage oral fluids. D. Educate about diet. Answer: B. Monitor cardiac rhythm. Rationale: hypokalemia can cause life-threatening arrhythmias. Question 33. A client with a central line develops sudden shortness of breath and chest pain after line manipulation. What should the nurse do first? A. Clamp the line. B. Place the client in Trendelenburg position. C. Administer oxygen. D. Notify the provider. Answer: B. Place the client in Trendelenburg position. Rationale: suspected air embolism, trap air in right atrium. Question 34. A postoperative client suddenly reports severe pain at the surgical site with swelling and tightness. What is the nurse's priority action? A. Administer analgesics. B. Elevate the limb. C. Assess for compartment syndrome. D. Apply ice. Answer: C. Assess for compartment syndrome. Rationale: this is a limb-threatening emergency. Question 35. A nurse finds a client's oxygen mask disconnected while the client is asleep with an SpO2 of 84%. What is the first action? A. Wake the client. B. Reapply the oxygen mask. C. Call the provider. D. Document the finding. Answer: B. Reapply the oxygen mask. Rationale: correct the problem immediately. Question 36. A client receiving total parenteral nutrition, TPN, has an empty bag and a new one is not yet available. What should the nurse do? A. Stop the infusion. B. Hang D10W temporarily. C. Flush the line. D. Notify the provider. Answer: B. Hang D10W temporarily. Rationale: prevent hypoglycemia. Question 37. A client with suspected spinal cord injury is brought to the emergency department. What is the nurse's priority action? A. Assess pain level. B. Immobilize the spine. C. Obtain vital signs. D. Insert urinary catheter. Answer: B. Immobilize the spine. Rationale: prevent further neurological damage. Question 38. A client with severe burns is admitted. Which intervention has the highest priority? A. Administer analgesics. B. Start 4 fluids. C. Apply sterile dressings. D. Monitor urine output. Answer: B. Start 4 fluids. Rationale: prevent hypovolemic shock. Question 39. A nurse notices a client's chest tube has accidentally been pulled out. What is the first action? A. Apply an occlusive dressing. B. Notify the provider. C. Prepare for reinsertion. D. Assess lung sounds. Answer: A. Apply an occlusive dressing. Rationale: prevent air from entering pleural space. Question 40. A client receiving 4 antibiotics develops hives and itching. What is the nurse's priority action? A. Slow the infusion. B. Stop the infusion. C. Administer antihistamines. D. Notify the provider. Answer: B. Stop the infusion. Rationale: prevent progression to anaphylaxis. Question 41. A 70-year-old client with pneumonia suddenly becomes confused and attempts to remove the oxygen cannula. What is the nurse's first action? A. Apply restraints. B. Reorient the client and ensure oxygen delivery. C. Administer sedatives. D. Call the provider. Answer: B. Reorient the client and ensure oxygen delivery. Rationale: confusion may be due to hypoxia, correct cause first. Question 42. A client with a history of seizures suddenly becomes unresponsive and begins convulsing. What is the nurse's priority action? A. Insert an oral airway. B. Restrain the client. C. Turn the client to the side. D. Administer oxygen. Answer: C. Turn the client to the side. Rationale: prevent aspiration and maintain airway safety. Question 43. A nurse is caring for a client with severe dehydration who has a blood pressure of 88/54 mm of mercury and tachycardia. What is the first intervention? A. Administer 4 fluids. B. Monitor intake and output. C. Encourage oral fluids. D. Notify the provider. Answer: A. Administer 4 fluids. Rationale: restore circulating volume immediately. Question 44. A client with a newly inserted feeding tube is about to receive enteral feeding. What is the nurse's priority action? A. Warm the feeding solution. B. Verify tube placement. C. Elevate the head of bed. D. Flush the tube. Answer: B. Verify tube placement. Rationale: prevent aspiration. Question 45. A client with chronic kidney disease has a potassium level of 6.8 milliequivalent/L and reports palpitations. What is the priority action? A. Administer calcium gluconate. B. Restrict dietary potassium. C. Monitor intake and output. D. Administer diuretics. Answer: A. Administer calcium gluconate. Rationale: stabilizes cardiac membrane urgently. Question 46. A nurse is preparing to administer a medication when the client states they are allergic to it. What is the best action? A. Administer a reduced dose. B. Verify the allergy and hold the medication. C. Notify the provider after administration. D. Document and proceed. Answer: B. Verify the allergy and hold the medication. Rationale: prevent allergic reaction. Question 47. A client with heart failure reports worsening shortness of breath and has crackles on auscultation. What is the nurse's first action? A. Administer diuretics. B. Place the client in high Fowler's position. C. Notify the provider. D. Restrict fluids. Answer: B. Place the client in high Fowler's position. Rationale: improve breathing immediately. Question 48. A client is receiving 4 insulin infusion for diabetic ketoacidosis and the blood glucose drops rapidly. What is the priority action? A. Stop insulin infusion. B. Administer D5 solution. C. Notify the provider. D. Monitor electrolytes. Answer: B. Administer D5 solution. Rationale: prevent hypoglycemia while continuing insulin. Question 49. A nurse finds a client choking and unable to speak. What is the first action? A. Call for help. B. Perform abdominal thrusts. C. Give water. D. Check pulse. Answer: B. Perform abdominal thrusts. Rationale: immediate intervention for airway obstruction. Question 50. A client post-thyroidectomy suddenly develops stridor and difficulty breathing. What is the nurse's priority action? A. Assess the surgical site. B. Call the provider. C. Prepare for emergency airway management. D. Administer calcium gluconate. Answer: C. Prepare for emergency airway management. Rationale: stridor indicates airway obstruction, life-threatening emergency. If these questions made you pause, rethink, or second-guess, even just a little, that's exactly the point. Common sense in NCLEX isn't easy, it's disciplined thinking under pressure. If you want more high-level, trap-breaking NCLEX questions, hit subscribe and keep sharpening your clinical instincts.